Hello, my name is Aasma Shaukat. I'm a gastroenterologist and a clinical researcher at NYU Grossman School of Medicine, and I'm also a staff physician at the New York Harbor VA. Today, I'm pleased to talk to you about our recently published very practical paper on tips to improve colonoscopy in your endoscopy unit. So let's get started. So the first question is, why talk about PrEP? Well, PrEP happens to be one of the most important things that we should think about in our endoscopy unit. We perform 20 million colonoscopies in the US every year. And guess what? All these colonoscopies require an excellent or an adequate PrEP. So how do we achieve it? And why should we achieve it? So let's answer the latter question first. PrEP is a quality metric, meaning it is one of the indicators tied to performance of colonoscopy. And in our recent ASGE document, the guidelines that have been set is that adequate PrEP should be achieved in 85% of all colonoscopies and 90% of colonoscopies for screening indication. So that's the bar that we must meet and exceed. So how do we achieve it? PrEP is not easy. Most patients complain about PrEP being the hardest part of their procedure. Therefore, we provide you some very practical tips on how to improve PrEP quality in your unit. And we lay down about 10 to 12 steps of achieving good PrEP. It starts with understanding your patient population, offering different kinds of PrEPs, because even though it's good to have one go-to PrEP, having some options is very, very beneficial because our patient populations vary. And as we think about our patient population, such as the elderly, where a low volume PrEP might be more desirable, or I think of the practice where I perform colonoscopy and we have patients with spinal cord injury, Parkinson's disease. So clearly there's a need to have more than one type of PrEP. Second, are your PrEP instructions very, very clear? And try to go for more pictures rather than words, and have your PrEP instructions ideally translated in more than one language. Again, keeping in mind who your patient population is. There's a wide variety of resources of how to achieve that. Next, assemble a team. Who are the key individuals that will help you or your endoscopy unit achieve the highest quality of PrEP? These would be your schedulers, the nurses, the nurse managers, administrators, and physician champions. Are you collecting data to be able to review the PrEP quality in your unit and then coming up with things that you can act upon, trying them out, and then seeing how well it worked? These are called the PDSA cycles: plan, do, see, and then act. So we must be following some PDSA cycles repeatedly to continue to improve PrEP. Also keeping in mind that the instructions need to be updated, and we should have a frequently asked question list for our patients to understand the most common questions that come up during the PrEP. And finally, gather and solicit feedback. Ask your patients, either formally or informally, how did we do? Are there things we can do better? What worked and what didn't? And this will really help us achieve the highest quality of PrEP, which leads to higher adenoma detection, greater patient satisfaction, and it's just overall important to achieve high quality colonoscopy and reduce the amount of rescheduled procedures or wasted slots. So I do hope you'll take a look at the paper and go through some of our practical tips. It's an easy read, and we'd love to hear your feedback and see how well it works. Thank you so much for your kind attention.